Shanmugapriya, lecturer from SNS College of Allied Health Science. Today we are going to see a topic or we are diving deep into osteology focusing on scapula or shoulder blade, a critical bone for the shoulder function and a key player in the operating room. And this lecture will cover everything from the scapula's anatomy to its role in surgeries and anesthesia. Next, we are going to see about the introduction of scapula. Let's kick things off with an overview of scapula. A flat triangular bone sitting on the back of your thorax, roughly between ribs 2 and 7. It's often called the shoulder blade because it is the foundation of your shoulders movement. The scapula does three main things. It provides mobility for your shoulder, acts as a hub for muscle attachments, and protects the thoracic cage, which houses vital organs like lungs and heart. Why is it important for you as an OT/AT student, that is Operation Theatre and Anesthesia Technology students? Well, the scapula is a common site of fractures, especially from high impact traumas like car accidents, and in operating room we will assist in procedures like fracture, fixation or shoulder injuries. So understanding the scapula's anatomy is crucial. Plus, it's a key landmark for anesthesia techniques like nerve blocks. Let's imagine you are in OT and the surgeon is working on the shoulder injury. Knowing the scapula's role, you can make a vital part of the team. So next we are going to see about the classification of scapula. So now let's classify the scapula. It's categorized as a flat bone. Unlike long bones like femur, flat bones are thin and broad, designed to provide a large surface of muscle attachment and protection. Scapula has a compact bone outer layer which gives it strength, and cancellous or spongy bone inside, which keeps it lightweight. This structure is perfect for its role in the shoulder girdle. Next, in OT, this classification matters because it guides surgical approaches. For example, when fixation of scapular fracture, surgeons need to know the bone's thin structure to choose the right tools, like the plates or screws for stabilization. Let's pause for a second. Can you think of another flat bone in the body? It might be a skull or a sternum. These bones share similar characteristics with scapula. Alright, let's move to this part. So, the parts of scapula. So, scapula has several key parts, and I want you to visualize them as we go. First, the body, its main triangular portion like canvas of the shoulder blade. Then on the posterior side you have a spine, a prominent ridge. You can see in this image, you can feel if you touch your back. This spine extends laterally into the acromion, a bony projection that connects the clavicle, forming acromioclavicular joint. Next, finally, the glenoid cavity is a shallow socket on the lateral side of the humerus. The upper arm bone fits to form a shoulder joint. Each part has a specific role. The body anchors muscle and spine, and the acromion provide leverage of movement. The glenoid cavity ensures shoulder stability. In the OT, these landmarks guide us surgeons. And for instance, during the shoulder arthroscopy, the surgeons might insert tools near the glenoid cavity. So you, as a OT technologist, need to know exactly where that is to assist effectively. Let's take a moment to visualize this. Imagine holding a scapula model. The spine feels like a rigid and the acromion is flat. Lateral tip, got it? Great. Let's keep on going. So next we are going to see the additional scapular features. So there are more features to explore. The coronoid process is a hook-like projection on the anterior side sticking out like a bird's beak. That's actually where its name comes from, coronoid. meaning, like a crow. Its key attachment point for the muscles, like biceps brachii, the scapula also has three borders, superior, medial and lateral. There are three angles, superior, inferior and lateral. These are the landmarks, are like mapped for the surgeons. And in operating theatre, these features are critical. For example, the coronoid process is a landmark for nerve blocks, like the interscalene block used in shoulder surgeries. As an anesthesia technologist, you might assist with ultrasound guided blocks near this area. So knowing its location is essential. Let's do a quick check. Can you point to where your coronoid process is? It's just below the clavicle, anteriorly. Okay, so in the next class we will be continuing with the muscles attached to the scapula. Thank you.